Hello, this is Dr. Eric Etka, the Richmond Chiropractor. We're in Richmond, Virginia, where we have a chiropractic practice where we help a lot of people, and specifically we become known for helping people get rid of their migraines. And typically it's females who are coming in between 25, 40 years old, very busy, have a lot on their minds, doing lots of things, trying to make sure that the house stays together, that they can keep the kids in line, they can keep all the schedules straight, and things get very, very hectic sometimes. So we take the time to sit down and we talk with them and find out exactly what's going on, how frequent the migraines are, what they have done to get them better already, because many people come in, they've already tried several different routes to get better. And the reasons for the things that we do with our patients are completely different than the way a medical doctor would look at a migraine. So we're going to go ahead and show you a couple things here. When patients come in, they ask me, my migraines are killing me, doctor, can you help me? And we smile, because typically 9 times out of 10, we can help people. So we go through, but we also have to explain to our patients, the ones that are hurting, like this lady here, there are different types of headaches. Now, of course, there's migraine headaches, there's tension headaches, sinus headaches, allergy headaches. And there are different descriptions and presentations of the symptoms, so we can find out exactly which one the patient is being bothered by. So typically your migraines are going to come from not so much different food sensitivities right away, or if you're in a stressful situation, but a lot of times there are specific things that do set these migraines off. And so we determine a pattern with the patients, and as we go through that, we're going to ask our patients 4 questions. Very important to know these 4 questions. And right off the bat, we ask the patients about artificial sweeteners, like Splenda, Equal, Sweet and Low, NutraSweet particularly, because these are chemicals that are actually neurotransmitters, actually excitatory neurotransmitters in your brain. And when they were first introduced, if you'd seen in the news and the media, epilepsy rates have gone up dramatically, as well as migraine problems. And we've rarely had a patient who had migraines who drank Diet Cokes, or they had different foods that they liked, or had Splenda. And once they brought that out of their diet, the migraines really started to decrease significantly. So the next question we would ask our patients is on the birth control. Any of the women out there on birth control, if they look at the pages that they get from their prescriptions and things like that, and look through the first side effects, migraines, headaches, those things are at the top of the list. So we know that there are an entire array of different pills and birth control methods possible, and we would just admonish to the patient to work with their doctor to find out the right one for their hormone imbalance. And if that's not possible, then there are several different compounding pharmacies that can obviously create the right kind of hormone levels for you, and we'd look into that with you also. Third, of course, is dehydration. Now we all know that once we're thirsty, we're already dehydrated. And we all know the certain answer, well, how much water am I supposed to drink every single day? And some say 8 glasses, some say half my body weight in fluid ounces. The one thing we talk to our patients about is your kidneys can only deal with about 1 cup of water per hour. So that's 8 ounces, just like a measuring cup you use for baking cookies or anything like that. So 8 ounces of water, maybe 3 or 4 gulps. It's more important to be consistent with a little bit of water throughout the day than trying to play catch up and go gulp a bunch of water and eventually just end up at the bathroom. So smaller amounts of water more frequently is going to help you feel a lot better. It's going to detoxify your body and give your kidneys the ability to use that water the way they're supposed to. Fourth, this is a really big issue for a lot of people. These 4 foods create inflammation in our body, every single person's body. Red meat, dairy, grains, and sugars. And yes, I understand a lot of people love to eat these foods, but there's a better way to choose better cuts of meat. There's better dairy we can have. The grains, we don't want them as processed. We want them more natural. And of course, sugars are just no good for our body anyway in their refined form. We can get either organic sugar, or you can get something like stevia. Now with the grains, we want to make sure that they're not the refined, processed, fortified, all the anything that's stripped of nutrients. Okay, so we'll have to look at that. Now, dairy, that does not include eggs. Dairy is your milk, your cheese, your ice cream, all of those things. With our patients, we are fine with them having a cup of yogurt per day. That's good for them. Now with the red meat, if you're going to eat red meat, we want to make sure that there's 3 or 4 days in between the time you're eating it, and hopefully it's a better cut than, let's say, corned beef or prime rib. So those 4 things are going to help you out, get some control of your migraines. And we are in Richmond, Virginia. And a lot of people want to see exactly how they can get in touch with us. Well, of course, if you're in the Richmond area, you can just call us at 804-784-3181. We're on Facebook. Our group is More Than Chiropractic. We're also on Twitter, Dr. Eric Etka. You can email me directly at therichmondchiropractor@gmail.com. And there again is our blog. And sitting right next to me is my beautiful wife, and sometimes she will be in the office with me. So I hope you enjoyed this video about migraines and migraine solutions, and I hope you feel better. Have a great day.